Dr. Saquib Zaffar Banday, Consultant Medical Oncology at Srinagar Institute of Medical Sciences, Srinagar. So as we know that November is the Pancreatic Cancer Awareness Month, so I would like to share my few thoughts and words on the same. Pancreatic cancer begins when abnormal cells in the pancreas grow and divide out of control and form a tumor. The pancreas is a gland located deep in the abdomen, between the stomach and the spine. It makes enzymes that help digestion and hormones that control blood sugar levels. Pancreatic cancer is a highly lethal disease for which mortality closely parallels incidence and currently ranks as the 12th most common cancer in the world, but has the notorious distinction of being the fourth leading cause of cancer-related death and is becoming an increasingly common cause of cancer mortality. Factors that may increase the risk of pancreatic cancer include smoking, diabetes, chronic pancreatitis, family history of genetic syndromes that can increase the risk, which include BRCA mutation, Lynch syndrome, and FAM syndrome, family history of pancreatic cancer, obesity, and older age. Most patients with pancreatic cancer remain asymptomatic until the disease reaches an advanced stage. Typically presenting symptoms of pancreatic cancer include abdominal or mild back pain, obstructive jaundice, and weight loss. Weight loss can arise from anorexia, maldigestion from pancreatic ductal obstruction, and cachexia. Occasionally, pancreatic obstruction could result in attacks of pancreatitis. Deep and superficial venous thrombosis is not unusual and might be a presenting sign of malignant disease. Gastric outlet obstruction with nausea and vomiting sometimes happens with more advanced disease. There is no standard program for screening patients at high risk of pancreatic cancer, such as those with family history of pancreatic cancer and chronic pancreatitis. Most pancreatic cancers arise from microscopic non-invasive epithelial proliferations within the pancreatic duct, referred to as pancreatic intraepithelial neoplasias. There are four major driver genes for pancreatic cancer: KRAS, CDKN2A, TP53, and SMAD4. KRAS mutation and alterations in CDKN2A are early emergence in pancreatic tumorigenesis. Endoscopic ultrasonography and endoscopic ultrasonography guided FFNA offer highly diagnostic ability for pancreatic cancer. Despite developments in detection and management of pancreatic cancer, only about 4% of patients will live 5 years after diagnosis. Patients with a pancreatic cancer are best managed by a multidisciplinary team that includes oncologists, surgeons, radiologists, gastroenterologists, radiation therapists, pathologists, pain management experts, social workers, dietitians, and when appropriate, may require palliative care experts as well. Pancreatic cancer is a heterogeneous disease at the molecular, pathological, and clinical level. The patient's response to treatment and outcome depends on many factors, including the biology of their cancer, their performance status, and their pattern of disease progression. Patients with pancreatic cancer are often divided into one of four categories based on extent of disease: resectable, borderline resectable, locally advanced, and metastatic. Patient condition is also an important consideration. Surgical resection represents the only chance for cure, and advancements in adjuvant chemotherapy has improved long-term outcomes in these patients. The risk of developing pancreatic cancer may be lowered by stopping smoking, Thank you very much.